Hi, everyone. My name is Dr. Stephanie Weyrauch. I am a physical therapist at MovementX in Billings, Montana. MovementX is a mobile practice. We go into people's homes, office, or outdoor space and turn it into their own personal physical therapy clinic. Today, I'm going to talk to you about life after breast cancer. Don't just survive, but thrive. We're talking about this because it's October, and October is National Breast Cancer Awareness Month. It's also National Physical Therapy Month. And one of the things that I hope that you get out of this talk is that a physical therapist is a really important part of the healthcare team for a cancer survivor. And we're going to talk specifically about breast cancer survivorship. So why am I qualified to talk about this? Well, I am a pelvic health and orthopedic physical therapist. Prior to working at MovementX, I lived in Connecticut, and I collaborated with the Yale New Haven Health Smilo Cancer Center to treat cancer survivors. I worked in an outpatient clinic, and because I specialize in pelvic health or women's health, many of the patients that were going through Smilo and were cancer survivors were coming to our clinic for treatment after they completed their cancer treatment. Breast cancer is something I've always had an interest in. Prior to going to PT school in undergrad, I did translational research at two different institutions, San Jose State University and Stanford University, where I looked at how various drugs affected breast cancer cells with the eventual hope that those drugs could be utilized for cancer treatment in the future. And now, as a physical therapist, I get to really help improve the quality of life of breast cancer survivors and other cancer survivors. So let's talk about breast cancer by the numbers. Breast cancer is the second most common cancer diagnosis in women, with the first being skin cancer. Approximately 30% of all new cancers that are diagnosed in women are breast cancer. The average age of a woman who is diagnosed with breast cancer is 62 years old. A lot of times we think about young women getting diagnosed with breast cancer, but most of the time, women who are older are the ones that are diagnosed. 1 in 8 women will have breast cancer in their lifetime, and 97.5% of women who are diagnosed with breast cancer will actually survive, which is a huge increase even from the last 10 years. In 2024, 4 million people were breast cancer survivors in the United States. So what do these numbers mean? Well, it means that most women diagnosed with breast cancer will actually survive the diagnosis. And a lot of that has to do with advancements that we've made in treatment. So now that we're focusing more on survivorship in breast cancer patients, we have to focus on what happens after the cancer is eradicated. There are a lot of challenges that cancer survivors face after they're done with treatment. And there's 3 main treatment areas that women have the option of pursuing depending on the type of breast cancer and the stage of breast cancer. The first is mastectomy. And with having a mastectomy, there are certain challenges that the breast cancer survivor will face after they are done with their cancer treatment. That includes limited shoulder mobility, pain, scar adhesions, and lymphedema. Now, what is lymphedema? Well, lymphedema happens when there are a certain number of lymph nodes that are excised from the axilla or the armpit area. The more lymph nodes that are taken out, the more likely somebody will get lymphedema. What the lymph system does is it basically helps to reabsorb waste product from our bodies and kind of cleanse our bodies of that. And when you lose lymph nodes, that fluid can build up, and that's when you see people with like big arms. The next option of treatment that women can pursue is chemotherapy. And chemotherapy also has its own complications. After chemotherapy treatment, breast cancer survivors can face cancer-related fatigue. They can have weakness, peripheral neuropathy, And this happens because the chemotherapy can damage the nerve endings within the hands and the feet. And that can lead to poor balance because of the damaged nerves. Brain fog is common, and of course, pain. The last treatment option for breast cancer survivors is radiation. And radiation also comes with its own complications after treatment is completed. That includes chest tightness, muscle stiffness, pain, and something called fibrosis, which is basically the loss of mobility and scarring of the soft tissue. So you can see that there's a lot of things that breast cancer survivors have to deal with after their cancer is cured. And traditionally, breast cancer survivors, once cancer is eradicated, the medical team says, "Congratulations, you've beat cancer." And then cancer survivors are not given the resources to manage the long-term complications. Very often, cancer survivors are told that they have to live with these complications, and that is not true. We know that there is strong evidence to support that an intervention like physical activity can actually prevent the reoccurrence of cancer, and it can help with some of these challenges that breast cancer survivors face. We also know that people who survive breast cancer, that breast cancer survivors, as they work through that cancer survivorship continuum, so from the end of their cancer treatment up until the end of their life, they gradually decrease the amount of movement or physical activity that they need. You can see from this graph here on the left, years prior to diagnosis, the black bars represent the recommendations of the American Diabetes Association and the American Heart Association recommend for physical activity over 150 minutes per week. The light gray bar represents people who get in between that, 1 to 150 minutes per week. And the light bars represent no physical activity per week. So you can see that many people who are diagnosed with cancer kind of fall here or here. And as the diagnosis is pursued, they get treated, they survive. You can see that as they work through this cancer continuum to 2 years after, 5 years after, and 10 years after, the amount of the guideline when they meet the guidelines for physical activity significantly decreases, and the amount that they are inactive increases. And a lot of that has to do with the fact that they have these complications and challenges and just don't really know how to get back to the lifestyle that maybe they had prior, or don't really know how to become physically active. This graph shows the trajectory in the change of cardiovascular reserve capacity for breast cancer survivors along the continuum. So cardiovascular reserve capacity is basically how fit is somebody, how much endurance do they have, and you can see that as the passage of time goes, that capacity significantly decreases. And a lot of this is due to the fact that with chemotherapy treatment and radiation treatment, chemotherapy treatment can have chemotoxic effects on the heart. And so this can increase the risk of cardiovascular disease. It decreases the ability for somebody to tolerate exercise, and it damages the heart. And so that's another reason why typically these individuals lose their capacity to exercise as their trajectory in their cancer survivorship continuum goes on. And we know that reduced activity levels throughout the cancer survivorship continuum increases the risk of morbidity and mortality. And we know that physical activity is protective against morbidity and mortality. So this is where physical therapists come in. We have the ability to treat cancer survivors and help guide them with the use of physical activity and other interventions to help them manage the side effects that come with the treatment of cancer. And these side effects include pain, fatigue, poor balance, strength, and endurance. So how can a physical therapist help survivors overcome challenges post-mastectomy? Well, we talked about how decreased shoulder range of motion is a common problem that can happen post-mastectomy. And so one of the things that a physical therapist can do is help improve shoulder mobility, range of motion, and strength. Mastectomy can come with pain, not just from the surgery itself, but when you are cutting out the breast tissue, you cut through a lot of the nerves, and it can cause sensitization or pain in those areas. And so we can offer treatments to help decrease that pain. We can also help improve soft tissue mobility and scar mobility. After you have a surgery, scar happens. That's how the body heals. And that can restrict mobility. It can restrict movement. It can cause pain. And so that's something that we can help with as well. And then we talked about lymphedema before, but we can help with lymphedema management by helping to find the right compression dressings that a patient potentially needs, teaching self lymph drainage techniques, and doing lymph drainage techniques to the patient ourselves. Physical therapists can also help cancer survivors overcome challenges of post-chemotherapy treatment. We talked a lot about how cancer-related fatigue is a common complication that cancer survivors face. And this can be done during cancer treatment or even after cancer treatment, but physical therapists can help improve activity tolerance, endurance, and strength. And with some of the damage that comes with the peripheral neuropathy that's caused by the toxic effects from the chemotherapy damaging the nerves, physical therapists can help provide balance interventions to improve stability and improve pain from neuropathy. As a person ages, fall risk becomes higher. And as people age, falls become a high reason for morbidity and mortality. And so our goal is to try to prevent that, especially because the median age that people get diagnosed with breast cancer is 62. So it's a little bit older. Brain fog, we talked about that as a side effect of chemotherapy. And so one of the things physical therapists do to help combat that is to apply dual tasking activities that improve brain function and coordination. And basically, dual tasking activities is assigning two different tasks at the same time and helping somebody kind of coordinate how they will do both of those tasks, which helps to increase brain power as well as muscle power. And then, of course, exercises for pain management. Post-radiation, physical therapists can help with stretching and flexibility to improve chest and shoulder mobility. Fibrosis and pain are common after radiation treatment, and so there's really effective things that physical therapists can do soft tissue-wise to help decrease the limitations that people have from this. And then pain is another one that can happen post-radiation, and exercise and manual therapy are two types of treatments that can really help with that. Now, if you don't have a physical therapist as part of your cancer survivorship team, there are some very specific things that you can do in your daily life that will help you get to the point where your physical activity time is increased throughout the day. So our goal is to just reduce sitting time in general. All cancer survivors should limit how much they don't move. So common things that you can do is take the stairs, use a standing desk instead of a sitting desk, park farther away from the store. Those are all things that you can do to try to incorporate movement into your routine. Ideally, you want to prioritize at least 30 minutes of walking per day. The American Heart Association recommends that Americans get to 150 minutes of aerobic exercise per week. That's about 20 minutes per day. And something as basic as walking can be protective against that. Now, many cancer survivors may not be able to hit that right away, and that's okay. That's what a physical therapist is there to help guide you to try to get you to that point. But that's what the goal should be, trying to get to 30 minutes of walking per day. And then because we know limited mobility is a main side effect of many of these cancer treatments, we want to make sure that cancer survivors are stretching at least 2 times per week. We know that exercise is safe for the cancer survivor, and we have a lot of evidence to support this. One of the landmark studies that was done in stage 2 breast cancer survivors that were undergoing cancer treatment. And basically the question they asked was, can the cancer survivor adapt to exercise training? Their protocol was 10 weeks of aerobic interval training on a cycle ergonometer. So that's basically a hand bike. The session was 20 to 30 minutes, 3 times per week, and the intensity was at 60 to 85% of their heart rate max. So in between, kind of like a breathless type stage. What they found with this study is that the cancer patients were able to complete the training program, and those who were trained were able to work harder, longer, and had better fitness than those who did not get this treatment. And you can see here that this is the results of their study. So this dotted line are the people that did not get the intervention and they got standard care. And the solid line are the people that did get intervention. And this is how much force they were able to exert. So you can see that the training group was a lot stronger than the control group at discharge. So can the cancer survivor adapt to exercise training even though they're undergoing these really difficult treatments? The answer is yes. What are the benefits of exercise training to the cancer survivor? There's a lot. We know that exercise is protective against cancer reoccurrence as well as survivorship. It helps cancer survivors live longer. Exercise helps to improve muscle mass, strength, and power, physical function, physical activity levels, range of motion, immune function, helping people complete their chemotherapy treatment because they are more fit, and it helps with self-esteem. It reduces how many side effects a patient will experience if they do engage in exercise while they're going through cancer treatment. It decreased hospitalization duration, the severity of side effects. It helped with stress, and it helped prevent depression and anxiety. So there's a lot of evidence to show that there are benefits to exercise training. And again, this exercise is not, running a marathon or lifting a ton of weights. It's something as simple as 30 minutes of walking every day. In fact, we know that a third of more than the 500,000 cancer deaths that occur in the United States are actually attributed to poor diet and physical activity habits. And so by being more active, we can even prevent cancer from happening. Cancer survivors who engage in regular moderate intensity activity live longer and are less likely to have a cancer reoccurrence compared to those survivors who are not physically active. And that's what this graph is showing. This first line here is showing people who are sedentary, which is less than 3 METs per week, which is a unit that we give to how hard somebody's working. People who engage in moderate exercise or even light moderate exercise, you can see live longer than those who are sedentary. And those who engage in vigorous exercise live even longer than those who engage in moderate exercise. So what are some exercises that you can do on your own to try to help with some of the side effects that happen? Well, this exercise shows self-manual lymph drainage within the most common area that is affected in mastectomies, which is the axilla or the armpit. And so how you do this exercise is you basically take your hand, bring it back behind your head, and take your other hand and lightly push the skin out. When you're doing manual lymph drainage, you don't push very hard. Basically, you just make a light dimple in the skin, but you never push hard. And that's because lymph nodes are so superficial. I like this exercise because it helps keep the nervous system mobile, and it also helps with range of motion. So this one is starting with your hand here, bringing it down, head over, and arm up. And it helps to stretch one of the nerves that is in this axillary bundle. This is just sliding your shoulders up a wall to try to improve how much range of motion a person has, which we know that shoulder limitations in shoulder mobility can happen after radiation and mastectomy. And we know balance can be an issue when people are undergoing chemotherapy. And so, by doing balance exercises like standing with your foot heel to toe with your eyes closed helps to stimulate some of the nervous system so that cancer survivor can help improve their balance in order to prevent falls. So our goal as physical therapists is, yes, we're so happy that you survived cancer, but just because you survived cancer doesn't mean that you are stuck with these complications that come with treatment. We can help you thrive and live a better quality of life. And we know that being active is a lifestyle change that has to continue for cancer survivors to maintain their quality of life and decrease cancer recurrence. If you are a cancer survivor, having support groups around you or physical activity clubs to get you out and moving can be really, really helpful in bolstering your activity. And if you don't have a physical therapist, a part of your cancer survivorship team, you should get one. We can help you increase your physical activity levels safely, keep you accountable, and treat some of these complications that come with these long-term problems that can happen because of cancer treatment. So in summary, cancer treatment has significant side effects that affect quality of life. Cancer survivors tend not to exercise after their diagnosis or after completing treatment. But we know that they can safely participate in and adapt to exercise training at all points in the cancer trajectory. So it's never too late to start. Physical activity improves survival and decreases cancer reoccurrence in cancer survivors. And so it is important to remain physically active. Physical therapists are essential members of the cancer survivorship team. We play a critical role in helping breast cancer survivors maintain their long-term health by addressing the physical side effects of cancer treatment and promoting overall wellness. And so we're thinking about what are your goals and how can we help you reach that? If you have any questions on this presentation, I'm happy to answer them. You can shoot me an email. My email is listed here. You can shoot me a text. My number is here, or you can contact me on Instagram. I'm happy to help support your cancer journey, survivorship journey. And if you aren't located in the Billings, Montana area, I can give you a recommendation of a physical therapist near you. At MovementX, we're located across the country. So I can also give you a recommendation for a MovementX physical therapist to come directly to your home and help get you on the road to wellness so that you can live well and move well. Thank you.